Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Longstrugs.
Well, aloha and good morning. Thanks for tuning in here to Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. This morning, we focus our conversation back to where it all really began for us here on Spotlight Hawaii, and that is regarding COVID-19. We know that COVID continues to rise on the mainland. We're seeing more and more cases. Hospitals are beginning to fill up again on the mainland. But this morning, we're going to take a different approach and focus specifically on a form or a side effect of COVID.
Yeah, we want to talk today about long COVID. We know that a number of people in our community and around the world are suffering with this ailment. It's a complicated disease, and so we've invited a wonderful expert here in Hawaii, Dr. James Yes, who is affiliated with the Queen's Medical Center and part of the post-COVID care clinic, is joining us live this morning. Doctor, thanks for being here.
Yeah, thank you for having me.
So as Ryan mentioned, we do see more COVID cases in our community and across the country. However, people seem to be taking the disease a little less seriously because the symptoms at the time, people are tending to recover from COVID, but you deal with a subset of individuals who do not. Tell us a little bit about what long COVID is and how it presents.
Yeah, sure. So, long COVID has been postulated to happen in about 20 to 30% of the patients that contract COVID. So it's not a small amount of people. Typically, long COVID is defined as symptoms that persist, reoccur, or are new symptoms that happen more than 4 weeks after the initial infection. So and the thing is there's a constellation of symptoms that individuals can have. They can have all of them or part of them. And so some of the most common symptoms that people may complain of greater than 4 weeks out of the initial infection is fatigue. That's probably the most prevalent. Cognitive issues, almost described as a brain fog, where people have difficulty concentrating, focusing, remembering things. Other common symptoms that patients suffer from are dizziness and lightheadedness, insomnia, depression, anxiety, chest pain, shortness of breath, and muscle aches or joint pains. Those are probably the top, but there are many other symptoms as well that people come to us seeking help.
And when you hear some of those symptoms that you just described, as someone who specializes in this, how do you determine at some point that it is in fact long COVID and you're not going down another path? Because some of those other symptoms could lead to some other type of disease or something that someone may be going through. How do you make that determination that classifies it as long COVID?
Yeah, that's a great question. So there's no one diagnostic tool or test that defines long COVID. It really is a symptoms-based diagnosis. So as a result, it's sometimes a diagnosis of exclusion. So for instance, we may, in our workup, try to exclude common medical illnesses that have diagnostic testing before we make the determination that it is long COVID. So I would say it's part of the workup, as you suggest, is making sure there's not an alternative diagnosis that has a simple or more clear solution.
You know, those numbers are really striking, to think that 20% or more of people who have been infected with COVID will end up suffering from this ailment. I think that, when you think about just how many people in our community have experienced COVID, these are really significant numbers. What are you seeing in terms of how many patients you're able to treat? And do you think a lot of people are walking around with this and not realizing that perhaps this is what they're suffering from?
Yeah, I think, as you suggest, there's a spectrum, and it can range from very mild post-COVID symptoms to very severe. And so some people might be walking around with more mild symptoms, thinking it's, just something they're going through, some type of funk. But what studies have suggested is long COVID can be as prevalent as 20 to 30% of all infections ultimately can be diagnosed as such. And we've seen in our clinic, which is a post-COVID clinic at Queen Emma Clinic at Queens Medical Center, we've treated so far over 350 patients who tend to have, I would say, more severe presentations, just because they know it's definitely not their norm, and they come in, more so than maybe a more subtle case. And what we're recognizing is, most of those patients will improve to their baseline within a year, but there is a small subset of patients that can persist and even go on for years. So it is concerning. And I would say maybe even close to 5% can be disabled for unknown length of time. And we're still trying to follow those patients to see their trajectory of recovery.
And if you can speak to, you mentioned the treatments, the 350 that you have seen during this time. What does that treatment look like for these individuals? Is there a medication, procedure? What does that process look like?
Sure. So there is currently no standard guidelines that we use to treat post-COVID patients. There's expert opinion. There's no one pill that is FDA approved to treat post-COVID. So what our treatments focus on are really symptoms-based treatments, treatments that can get the patient functionally to a better place. And so we do have a lot to offer in that regard. We also, I think, are very important in that we offer validation to the patient that this is not a made-up disease, this is real. And that's a very important part of the visit. Also, in addition to that, I think treating the patient's symptoms, as well as working on a lifestyle, a holistic individual plan to get them better. All these patients are individuals, and they might have different, they need to be treated as such. And it really takes an individualistic approach to symptoms-based management. And so for an example, if someone has weakness they just feel generally weak after their COVID, or experience dizzy, there are treatments regarding to rehabilitation that have been shown effective to get these patients back to a better functioning state. And so we often utilize our subspecialists that are involved in these different systems to help with treating the patient's symptoms and improving their functionality.
We always like to bring in questions from the audience. This one comes from Ingrid. She says, do repeated COVID infections increase one's risk of long COVID? There is a feeling among plenty of folks that, oh, I've had COVID, I don't need to worry about this. I have herd immunity, if you will. All of these. I don't know if you'd call them misconceptions, but I am interested in what Ingrid's question. Once you've had COVID once and you've gone through it, and you haven't gotten long COVID, the next time you unfortunately contract COVID, is the slate clean, or does the prior infection sort of indicate that you're not going to get it?
Yeah, no. So let me answer that question in a couple of different ways. One is that if you've had COVID and you've had no long COVID after that, you recovered fine, let's say, you still have a chance of getting long COVID after another repeated infection. Second thing is, let's say you had COVID infection and you suffered some long COVID symptoms. Another infection can re-exacerbate those symptoms. That's what we've kind of found out in our own clinic. And then finally, there are some ways we think can mitigate the adverse effects of being reinfected. Number one is getting vaccinated. There's been 15 observational studies that have shown that vaccination can help mitigate long COVID symptoms and also help prevent long COVID from happening. It reduces the chances. There's also some evidence in recent literature that it's a suggestion that being treated with certain antivirals for those who qualify can reduce chances of long COVID when you're going through an acute infection. That is still being studied. It's still trying to be validated, but there's some recent suggestion that may help preventing long COVID.
I'm wondering if you can share more about what you're seeing in your treatment facilities and those that you're working with. Is there any commonality? Are you noticing any trends with the type of people that you're treating, whether it be in specific age demographic or any common variable that might link this group of people together who are all kind of experiencing this?
Yeah, sure. So we're still trying to work out what are the risk factors, which I think you may also be asking. And what we do know from the literature and from our clinic is that certain risk factors predispose you to long COVID. You don't necessarily have to have them, but it increases your risk. So being obese, having diabetes, chronic underlying medical conditions, such as heart disease, asthma, other lung issues can certainly increase the risk. There seems to be a slight increase, or I should say a slight higher prevalence in women, but that's trying to be worked out as we speak in certain studies. But to be honest with you, besides those risk factors of chronic underlying disease, age, we're still trying to work out what are the individual risk factors and why certain patients get it and certain patients don't. But in our clinic, we're seeing patients of all ages, races, male or female. It doesn't matter. It really spans ages and other demographics.
Wow. And you did talk about this subset of patients who do not recover after a year. How, what is that like, and what do they most chronically suffer from? You said that some can even end up being disabled. How serious are the symptoms and how do those present?
Yeah, so definitely it's those individuals that suffer long-term symptoms that are not necessarily abating or returning to their baseline. They seem to happen more predominantly in patients that have been in the ICU during their acute infection, having long hospitalizations for their acute infection, being on ventilators, and those patients have lung damage often that doesn't return back to normal. And so for those patients, sometimes it involves that they have to readjust their lifestyle and functionality to not being as conditioned from a cardiac and lung perspective. And so some of those individuals are not able to return to work. Unfortunately, it's not limited to just lung symptoms. Some even patients that have persistent brain fog, fatigue, are not able to get back to their baseline. And I would say it's about 5% of patients that develop long COVID may be at risk for being chronically disabled and unable to return to work. And so what life looks like for those individuals is, I think they can still have an improvement in their functionality, still get a better quality of life, but the expectations have to be readjusted. And life does change for them. And we as a society have to acknowledge that, and in my opinion, and provide additional resources so they can still live fulfilled lives.
Speaking of those resources, are those types of resources, information being worked on and being made available? If you can speak maybe on the national level, what you're hearing, how much research and how much effort is being put into understanding long COVID more? Because there seems to be still a lot of question marks. And granted, this is 2 to 3 years into this process as we come out of this pandemic. But if you can share about what's happening on a national or even global level, is this conversations that are happening to help to advance the information that you are able to obtain and thus be able to pass along to patients?
Yeah, so we're fortunate enough in our clinic and at Queens to be part of a national NIH-funded 4-year study studying long COVID. And so this NIH National Institute of Health study has enrolled over 17,000 patients. And we're fortunate enough in our clinic, post-COVID clinic in Queens, to be collaborating with JABSOM to studying exactly what you're bringing up. And so there's actually, the study is called the RECOVER trial. And our role, one of the things that we're specifically studying as part of that study at Queens is how we initially studied in the first part of it, what is the natural progression of the disease, what are the risk factors, and now we're kind of changing gears in terms of looking at treatments. And so a couple of things that we're investigating is, do antiviral treatments that initially were used and are still used for acute infections, can they provide benefit for chronic and long COVID symptoms? And another one that we're studying actively is looking at the gut microbiome and seeing if adjusting that has any influence in recovery and long COVID. So that big study that we're a part of is hopefully moving the needle in terms of finding treatment options. And so we are part of a bigger picture, a national picture here locally. And I think why it's important to do it locally is because we have such unique demographics in Hawaii, and we need to give representation to those people and really have them studied so that we can provide actionable benefits to the people that live here. And so that representation matters.
You spoke about just giving people confirmation and making them feel like, oh, yes, I am suffering from something that is real. Can you talk a little bit about what these patients have experienced, leading up to this diagnosis? Because it must be very confusing because this is so new. And in that sort of same genre, what about insurance and medical coverage? Since this is such a new disease and we're just sort of, building the bike as we're riding it here, how are they able to get reimbursements? I know you don't really cover that part in your own clinic, but what are you hearing from patients in terms of getting these procedures covered?
Yeah, sure. So I think for the most part, insurance has provided the necessary coverage for symptoms-based treatment. They certainly are hesitant to cover experimental treatments that haven't been validated in peer-reviewed research. But for the most part, we haven't had a huge amount of barriers with getting patients into our clinic and being covered by most of the insurances we have in Hawaii. And I would say that there needs to be a lot more buildup of resources that we can provide for the treatment of patients, and I think there's room to grow, whether it be supportive services, rehabilitation services. I think we could we have more to do in terms of providing wraparound care for these patients. And so I think there's not a lot of barriers, but we need more infrastructure built up to support these individuals, because it really does take a holistic approach. And I would say a lot of the patients that, before they've come into our clinic, I think you were asking this as well, they've experienced a lot of frustration. You know, a lot of them have great primary care physicians, and they do offer superb advice. But if they haven't had a chance to see their primary care doctor, I think there's a level of frustration because not everyone is completely understanding that these symptoms can be pervasive and they can last a long time. And I think that recognition has not been something many of our patients have experienced in the community. And I think that lack of validation has been heartbreaking and anxiety provoking. And I'm glad to say that our clinic, among many other things, I think does provide that level of recognition and understanding.
No, I don't mean to downplay the symptoms that you described with long COVID, because it does sound like it could make life miserable for many people who are still struggling to just do day-to-day activities. But do these symptoms and what people are experiencing long COVID ultimately end up resulting in a fatality, or end up going down the path where long COVID could lead to some sort of debilitating disease to the point where they actually may die and ultimately lose their life to it? If you can speak to how the severity of how far long COVID goes, is it something that people just have to learn to live with based on the symptoms provided, or can it escalate to something more and something more deadly?
Yeah, so a couple of thoughts on that. The good news, I do think the majority of patients with long COVID do get better within a year. So I don't want to be too pessimistic, and certainly with symptoms-based treatment, I think they get to that baseline quicker. And so I think there is room for optimism. I'd say, as I was saying, I think before, about 5% of patients fall in the trajectory of being chronically affected longer than a year, maybe two, maybe longer. The honest truth is we don't know the trajectory of what the end result of these patients are, because the pandemic's only been around for 3 years. So what I would suggest is we still need to learn a lot more about the research aspect of things. What I do know is that, we don't know in terms of mortality, long-term mortality from chronic COVID. We don't have the data for that yet. But what I think what we should recognize is some individuals get so despondent about their new symptoms, their new level of functionality, that they often get very depressed, question, taking their own lives. And that's something we as a society and a community can be better supportive of, because those individuals need treatment. They need treatment early, and there's ways to set expectations where they don't need to go down that path of being completely despondent. There's ways to treat this and feel better. And I think that recognizing that can prevent a lot of these patients from ultimately thinking they don't have any hope. And that's what we can work on.
And on that point, Heidi's question here from our audience comes right into play, which is, are mental health services offered? How important is that, mental health component of the treatment that you are providing?
Yeah, I think it's absolutely not only important, it's necessary at all levels of this condition. And so in our clinic, we have mental health providers that we refer to. We have therapists or counselors that we refer to. And it's not only important, but it's necessary. And we need to continue to strengthen those bonds with our mental health providers, because think about, we think that long COVID can not only independently contribute to depression and anxiety, but people can get depressed, anxious because of their physical ailments. And so there's so many ways in which people need to talk these feelings through, get necessary treatment and cognitive behavioral therapy. And I think that's been shown to be very helpful. So I am a big advocate to utilize those services, and we need more of them, to be honest.
Oh, unfortunately, our time is almost up. But before we go, wanted to just give you the opportunity for a final thought and message. Again, regarding this subject, there seems to be a lot of people who have moved on from COVID, and we recognize just on this conversation, although there are quite a number of individuals within our own community that continue to suffer through this long COVID. What would your message be to the public about that long COVID and the treatment that you're providing, and just your overall thoughts about what the pulse and the temperature is about long COVID in our community right now?
So this is definitely a parallel pandemic. Long COVID and the people who suffer the symptoms of long COVID will be around for many, many years. And it's something that we can't, and as a society, we can't ignore, because there are neighbors, there are family, there are friends, and they deserve more research and they deserve more help. And it is a real condition. It is something that needs to be recognized as such. And we really need to move in that direction, providing long-term support for these people, and really getting to a place where we have wraparound, holistic, individual-based treatment plans. And the doctors who do this need the time to be able to spend that dedicated, personal, get to know you type conversations with the patients. So it's going to take a little bit more resources and a lot more recognition, but I think we're moving in the right direction in our clinic in providing the longitudinal, long-term services to these patients. And I think we just need to recognize that this is not a one and done thing. This is going to require a long-term solution. And the people that have these conditions, it's worth it for them. So I kind of just leave it on that note.
Dr. James Yes with the Queen's Post-COVID Care Clinic, thank you so much for joining us. We really, really appreciate it.
Thank you so much for having me.
Thank you, Aloha.
Well, very sobering conversation, Ryan. If you think about just the numbers that he's talking about, up to 20% or more of people who, contract COVID experience long-term COVID to some degree. The vast majority, he says, recover in about a year, but still a year of the chronic fatigue that he's talking about, depression, anxiety, muscle fatigue, a host of different symptoms that he brought up, also some vascular conditions and some lung issues. And then talking about that 5% or more subset who take 2, 3, we don't know how many years to recover, perhaps never recovering fully and having to set a new baseline. That's pretty tough to think about, especially, think about your own sort of circle of friends, how many people who have contracted COVID.
Yeah, and I think one of the things that he said at the end was pretty interesting, that this will become a parallel pandemic in dealing with long COVID, knowing and recognizing the amount of people that continue to suffer through this, as you mentioned, through about a year or so, and the system-based care and the types of treatment that they are providing really based on the symptoms that people are presenting. So there isn't necessarily a shot, a medicine or anything that has been developed to target it. Really, the technicians and the medical staff around these patients are having to work with each individual on a case-by-case basis to essentially figure out what they're suffering through and finding other means of medication that could probably help them to lead a life of more normalcy and get them back to a place where they feel more comfortable in an everyday living. But yeah, just an interesting conversation as we continue to move through this pandemic. Again, we're seeing some of those numbers and the uptick on the mainland with hospitals becoming full. Of course, this with, it combined with a heavy flu season as well. And so officials, no doubt here in Hawaii as well, are watching everything that's happening. But as he said, the research and really the science behind all of this continues.
Yeah, and prevention, of course, is the best medicine. The best way to do that, he said, is not get infected in the first place. And we can achieve that, hopefully, with vaccinations and also just taking those precautionary measures that we've talked about for years now on this program. Social distancing, wearing a mask, staying home if you're sick, and isolating from others who may be sick in your community. We know all those practices. A lot of them have, unfortunately, fallen by the wayside as we try to embrace life as usual. But this is something that we will continue to track because we do know that so many in our community are suffering from it. And I thought it was really important also this idea that people really need validation and recognition to know that they are not, this is not just in their head, this is a real thing. And this is something that we will be dealing with as a community in the years to come. On Friday, we are going to be talking about the economy. We like to switch gears quite a bit here. The Fed raising interest rates again today. And so what does that mean for us here in Hawaii? How is the economic recovery going? We're going to be talking with Professor Carl Bonham.
Yeah, we always enjoy getting his insights because he really brings it home here to a local level, examining what's happening on a number of industries that, of course, impact our economy, including tourism, the Japanese market, and the Japanese return to the islands. Not quite what was anticipated by tourism officials. So how is that going to impact us? How are the proposed tax cuts also that the legislature and Governor Green have in mind? How will that also impact our economy? All those questions we look forward to asking and presenting to Dr. Bonham. Always a great conversation. We hope you'll join us on Friday for another episode of Spotlight Hawaii. Until then, take care and aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.